Diabetes doesn't always come with obvious symptoms, and for women, the warning signs can be especially unique and often overlooked. Could your body be sending subtle signals that you've been brushing off as nothing? What if those unexplained changes in your health were actually pointing to something serious? In this video, we're uncovering 8 surprising signs of diabetes that every woman needs to know to protect her health and take control before it's too late. Diabetes is often called the silent disease for a reason. Its symptoms can be so subtle that they're mistaken for everyday issues or ignored altogether. For women, it's even trickier. Hormonal changes, pregnancy, and the way our bodies react to blood sugar imbalances can make certain symptoms more distinct and, at the same time, easier to overlook. But here's the thing, catching these signs early is crucial to prevent serious complications. In this video, we'll reveal 8 surprising symptoms, some that may seem completely unrelated, that could be your body's way of flagging an underlying blood sugar issue. Let's dive in. Sign number 1. Unusual fatigue. Let's dive into a symptom that's easy to overlook but could be telling you something important. Unusual fatigue. We all know what it's like to feel tired after a long day. But what about those times when the exhaustion doesn't seem to make sense? For women, this can be especially tricky. Fatigue often gets brushed off as a result of juggling work, family, and everything in between. Add hormonal changes or stress into the mix, and it's no wonder many women don't see this as a potential health issue. Here's what's happening beneath the surface. When your blood sugar levels are too high, your body struggles to effectively use glucose, your main source of energy. Without that fuel, your cells feel starved, even if you've eaten recently. On the flip side, if your blood sugar drops too low, your body goes into overdrive trying to compensate, leaving you feeling completely wiped out. It's a double-edged sword that can sap your energy, no matter how much sleep you get or how healthy you think your routine is. But here's the thing, this isn't just about being tired. If you're waking up feeling exhausted or you notice that simple activities leave you drained, it could be a subtle but serious sign of diabetes. Pay attention to these patterns and monitor how often you're experiencing this. Fatigue that doesn't go away with rest is your body's way of waving a red flag. Don't ignore it. This is the perfect time to consult your doctor and get to the root of the issue before it worsens. Sign number 2. Increased thirst and frequent urination. Have you noticed that you're always thirsty, no matter how much water you drink? Or maybe you've been making more trips to the bathroom than usual. These could be more than just minor annoyances, they're classic signs of diabetes. Here's why. When your blood sugar levels are too high, your kidneys have to work overtime to filter and remove the excess glucose. In the process, they draw more water from your body, leading to dehydration. That's why you might find yourself constantly reaching for a glass of water to quench your thirst. But here's the catch, drinking more fluids alone won't solve the problem. Your body's telling you something isn't right. If you find yourself caught in this cycle of thirst and frequent urination, it's a signal that your blood sugar levels might be out of control. Many women brush this off, thinking it's just because they're staying hydrated or drinking more coffee, but it's important not to ignore these symptoms. What can you do? Start keeping track of how often you're drinking water and how many times you're visiting the bathroom. If the pattern persists, it's crucial to consult your doctor. Early detection can make all the difference in managing diabetes and preventing complications. So listen to your body. It's trying to tell you something important. Sign number 3. Recurrent yeast infections. Recurrent yeast infections might seem like just a frustrating inconvenience, but they can actually be a red flag for diabetes. Here's the science behind it. High blood sugar levels create the perfect environment for yeast to grow and thrive. When glucose levels are elevated, the excess sugar can affect various parts of your body, making infections more likely, especially in intimate areas. For women, this can mean dealing with repeated bouts of itching, discomfort, or unusual discharge, symptoms that may not seem related to blood sugar at first glance. Many women might blame hormonal changes, stress, or even hygiene products, but if these infections keep coming back, it's time to dig deeper. So what's the solution? Managing your blood sugar levels is key. Keeping glucose under control can help prevent these infections from recurring. If you've noticed this pattern, don't just treat the symptoms, address the root cause. Talk to your doctor about getting your blood sugar levels tested. Early detection and proper management can help break the cycle and improve your overall health. Sign number 4, blurred vision. Blurred vision isn't just a sign of needing new glasses. It could be your body's way of warning you about diabetes. Here's what happens. When blood sugar levels fluctuate, it can temporarily change the shape of the lenses in your eyes. This affects how light is focused, leading to blurred or distorted vision. What's tricky is that many people dismiss it as eye strain from screens or simply age-related changes. But if this happens repeatedly or worsens, it's time to take it seriously. Left unchecked, high blood sugar can lead to more permanent eye problems like diabetic retinopathy, which can damage the blood vessels in your retina. So, what can you do? Schedule regular eye exams, especially if you're noticing changes in your vision. Be sure to mention any blurriness to your healthcare provider. They might recommend checking your blood sugar levels. Remember, early intervention isn't just about protecting your eyesight. It's about taking charge of your health before more severe complications arise. Sign number 5, unexpected weight changes. Sudden and unexplained changes in weight can be more than just fluctuations from diet or exercise. They might signal issues with blood sugar control. Here's the connection. In the case of weight loss, your body may start breaking down fat and muscle for energy if it's not getting enough from glucose due to insulin problems. On the other hand, weight gain can occur when high blood sugar leads to increased hunger, causing overeating and fat storage. This is often misunderstood. Many women might think, maybe it's just my diet or hormones, and not consider diabetes as a potential cause. Ignoring these changes can delay crucial diagnosis and treatment. So, what can you do? Pay attention to patterns in your weight that don't align with your usual habits. If you're losing or gaining weight without explanation, don't just shrug it off. Consult your doctor. It's not just about the numbers on the scale. It's about uncovering what's happening beneath the surface to protect your health. Sign number 6, numbness or tingling in hands and feet. Ever experienced a tingling or numb sensation in your hands or feet and brushed it off as nothing? This seemingly minor discomfort could be a warning sign of high blood sugar affecting your nerves. When sugar levels remain elevated over time, they can damage the delicate nerve fibers in your extremities, leading to the sensation, medically known as peripheral neuropathy. This isn't something to ignore. If left untreated, it can progress to more severe complications like chronic pain, loss of sensation, or even difficulty with movement. Many women dismiss it, thinking it's due to poor posture, stress, or fatigue, but if it's happening frequently, it's worth paying attention to. What can you do? Early intervention is key. If you notice consistent numbness or tingling, especially if it comes with other signs like fatigue or increased thirst, reach out to your